Hi guys, it's Amber and I'm back with another tips and tricks video. Today we're going to be talking about strokes and the FAST method for you to be able to identify a stroke as quickly as possible. A stroke is a serious medical emergency, and the likelihood of surviving a stroke is much higher the faster we react. Strokes are actually the 5th leading cause of death here in the United States, and one senior over the age of 65 dies from a stroke every 4 minutes. So it's something we need to be able to identify so that we can react quickly. Let's talk about what a stroke even is, right? I feel like we've all heard the term stroke, or we know of someone who has had a stroke, but we may not really understand what's medically happening. Basically, a stroke is just disruption of the blood getting to the brain. So our blood delivers oxygen to the brain, and if there's any disruption of that, it can actually cause brain damage. So again, a stroke is just simply a disruption of blood getting to the brain. Before we talk about what you can do in the moment someone is having a stroke, let's talk about identifying the symptoms of a stroke, things that we can look for in our loved ones to know whether or not they may be experiencing one. Symptom number 1, sudden weakness on one side of the body. This can include facial drooping, and it can also include sudden loss of use in arms or legs on one side of the body. Symptom number 2 is going to be slurred speech. So the speech of our loved ones may actually be really disruptive. They may not be able to put a sentence together. They may have difficulty understanding what someone is saying to them. And like I said, their speech in and of itself will be slurred. Symptom number 3 is going to be a change in vision. They may lose some of their eyesight in one or both of their eyes, or it can be a little less severe and they may just have blurred vision. Symptom number 4 is going to be a sudden change in coordination. Your loved one may suddenly be unbalanced, they may suddenly trip, they may suddenly get really dizzy. Either way, their coordination is going to be off. Symptom number 5, and our last symptom today for a stroke, is a really awful headache. Someone who has experienced a stroke can often describe this headache as the worst headache they have ever had. It is so bad that it may actually induce vomiting. So if your loved one is suddenly experiencing a very severe headache, go ahead and check them for those other 4 symptoms that we just talked about. And if they have one or more, you may need to react because your loved one may be experiencing a stroke. The National Stroke Association has come up with an acronym, FAST, F-A-S-T. It is a very easy way for everyone to remember the most common signs of a stroke and what to do if you start noticing these signs. Let's get into it. The F in FAST stands for face drooping. If you notice your loved one's left or right side of their face start to droop, ask them to smile. If they can't smile like they naturally would, they are most likely experiencing a stroke. The A in FAST stands for arm weakness. If your loved one is complaining of weakness or numbness in one of their arms, ask them to lift both of their arms. If they can't lift both of them, or if one of them kind of drops off, that is going to be a sign of A, arm weakness. The S in FAST stands for speech, particularly slurred speech. If you notice some changes in your loved one's speech, ask them to repeat a very simple phrase. My name is Amber. And if there's any changes in their speech, or if it's slurred, that is going to be one of our top 4 FAST signs of a stroke. Lastly, the T in FAST stands for time. And I think this is actually a 2-parted thing. One, T, time. Look at the time when your loved one starts experiencing symptoms. The doctors will ask you how long someone was experiencing a symptom or how long this has been going on. And if you can take a quick look or a quick peek at the clock and kind of track the time, it's going to be very, very helpful. Also, T stands for time to call. Call 911. Call an emergency medical service. Or take your loved one to the hospital and let them know that you think your loved one is experiencing a stroke. I'm assuming that they will then move forward with a bunch of tests, but the sooner you catch it and the sooner you get medical attention, the better. Acting quickly in the case of a stroke is absolutely essential. The likelihood of your loved one recovering from a stroke is much, much higher if medical attention is sought after within 3 hours of symptoms. Of course, we don't want to push that. Of course, sooner the better. But even if you hear your loved one talk about their day and, complaining of any of these symptoms, it's still best to go ahead and get medical attention and at least have them looked over. But again, time is critical. The faster we identify these symptoms, the faster we identify a stroke, the faster attention, the better. Thank you so much for tuning in and catching up with this week's tips and tricks. As always, you can catch up on the Share the Care show on both Apple Podcast and Spotify Podcast. You can also hop over to the Home Care Assistance of Carmel YouTube page or the Care by Christy YouTube page. We house all of it there as well. So I will see you guys next week with another tips and tricks. Thank you.